Welcome everyone. Thank you for joining us today. I'm Theresa Marentette, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today is the first day of the new assessment center in Leamington at Erie Shores Healthcare. The hours of operation are 8 to 4 p.m. I will now share the most current case counts. There are 28,381 confirmed cases of COVID-19 in Canada and 8,447 cases in Ontario. Chatham-Kent has 25 cases, and Sarnia-Lambton has reported 128 cases. Michigan now has 28,059 cases, with 7,136 cases in Detroit. Today we are reporting 19 additional confirmed cases of COVID-19 for a total of 427 cases in our community. 55 people have recovered. 19% of our cases are between the ages of 50 and 59 years, and 22% of our cases are 80 years or older. 38% are male, and 61% are female, and 1% are unknown at this time. We are sad to report one additional death due to COVID-19. Our community has lost a total of 17 people to COVID-19. 10 deaths have occurred in long-term care and retirement homes. Our health unit continues to work with 7 long-term care and retirement homes that are currently experiencing COVID-19 outbreaks. 38% of all of our cases are in long-term care. The health unit continues to follow up directly with everyone who has tested positive and negative for COVID-19. We will let you know when you are able to check your results online, but for now, we will call you to let you know your results. It is important to remember that you must remain in self-isolation while awaiting your test results. Overall, 2,936 individuals have been tested for COVID-19, and of those tested, 357 tests are pending. Testing for COVID-19 should be based on a clinical assessment. Healthcare workers, caregivers, care providers, and first responders should all be tested as soon as possible if they develop symptoms. Testing guidelines also include testing symptomatic residents of long-term care and retirement homes. This includes testing residents without symptoms who are new admissions or readmissions to these homes within the first 14 days of their arrival. Also, residents being transferred from a hospital are to be tested prior to being transferred back home. All residents will be required to remain in self-isolation for 14 days following their admission. During a COVID outbreak in a long-term care or retirement home, testing will be increased to include asymptomatic residents who are contacts of the ill resident. I need to send out another big thank you to EMS for their support in providing testing to some of the homes currently experiencing a COVID outbreak. Certain groups have been prioritized for testing in the event of shortages of supplies, including symptomatic healthcare workers and staff who work in healthcare facilities, symptomatic residents and staff in long-term care facilities and retirement homes, hospitalized patients with respiratory symptoms, symptomatic members of remote, isolated rural and Indigenous communities, symptomatic travelers identified at a point of entry to Canada, symptomatic first responders, including firefighters, police, EMS, and individuals referred for testing by our health unit. Please continue to visit WECHU.org for the most current information and case counts. Symptoms of COVID-19 include fever, cough, or difficulty breathing. However, other symptoms may be present, such as being extremely tired, falling, nausea, vomiting, and headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, please complete the online self-assessment tool at ontario.ca or contact Telehealth Ontario or call your primary health care provider for a home assessment, a phone assessment, or a virtual assessment. They will be able to guide you in next steps, including contacting public health or attending an assessment center. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning. As you can see, our case count is now at 427 with 19 additional cases. We also reported a new death. She's a female in her 80s with multiple comorbidities and passed away in the hospital. She was not a resident of a long-term care home. She was a community person. Our condolences go out to the family as they grieve the loss of their loved ones. As I said earlier, it is not easy to announce these deaths, and it really is a loss to our community. It also highlights the importance of protecting our loved ones. All the measures we are taking right now, it's not only about protecting ourselves, it is also about to protect our loved ones. If our elderly parents and grandparents are not going outside, and if we are also limiting our trips, we are doing our part to protect them. Please keep practicing physical distancing at all times and follow the public health recommendations. This morning I want to talk about the lab testing because we have heard many questions about the lab testing, false positive, false negatives, and the availability of other type of testings in the province. Public Health Ontario recommends collection of a nasopharyngeal swab specimen to test for COVID-19. The lab detects the RNA using reverse transcription polymerase chain reaction, or RT-PCR, to detect the virus of COVID-19. A positive test generally confirms the diagnosis of COVID-19, although there have been instances when the results may come back as either a false positive or a false negative. A false positive essentially means that the results we are seeing is actually a negative, but because of the testing process, it is incorrectly identifying as a positive. From a public health and disease control perspective, it is erring on the side of caution, because having additional measures on cases, even if they are false positive, will be more protective for our community. However, when it comes to false negative, it is more problematic. False negative means that we are seeing is actually a positive case, but because of the lab testing process, it is incorrectly identifying as negative. From a disease control perspective, it could lead to spread of the disease because individuals or healthcare provider may not use all the appropriate precaution to limit and contain the spread of the disease when we have a false negative identification. There are a few things that we do in public health to reduce the likelihood of false positive by focusing first on choosing the right test. That includes the approved PCR-based testing from Public Health Ontario. Even though there are rapid test kits available, some approved and some not approved, but unless they are assessed for their validity and the likelihood of their false negatives and false positive, it'll be too risky to use and get a false sense of security when there is a possibility of false negatives with these testings. The second thing what we try to do is the timing of the test. If a test is done too early, it may not have enough viral load to detect the viral RNA. Most of the PCR tests are pretty sensitive to pick up those tiniest amount of RNA in the nasopharynx. That's where the maximum concentration of the virus is found. The appropriate technique is another important thing that when we're talking about these tests. It is appropriate to ensure that we are using the appropriate swabs and technique to test these cases. Any incorrect swabs or improper technique and the swab not going all the way back to the nasopharynx may not give us the right result. And all of these issues can give either, most likely will give a false negative, and that's what we are trying to avoid. Some of these recommendations around testing, focusing on the symptomatic, the right timing of the test, is important from a disease control perspective. As I said, getting a false negative, it is much more problematic from a public health perspective. False positive may not be as big of a concern when it comes to talking about false negative. Timing of the testing, symptoms of the testing, technique of the testing is very important in making any of these diagnoses. I'll conclude by saying we must continue all these measures to contain the spread of COVID-19 in our community by ensuring that we are washing our hands regularly and thoroughly. We just have to repeat doing what we are doing every day. The recommendation hasn't changed. Coughing or sneezing into your sleeves or tissue, disposing of the tissue immediately. Keep surfaces clean and disinfected. Stay home unless it's essential to go out, and stay home when you're sick. Practice physical distancing at all times from all people who do not live in your same household. Thank you.
media. We'll start with AM800.
Yeah, just quickly before my question, the website just said 18 deaths. That's different than what Theresa said?
It seems like it's a typo, and we will be correcting that, and the website will be updated as soon as we confirm that.
Okay, thank you. So my question then, I've actually seen a lot of people on Facebook and Twitter commenting that they would like to see a better breakdown in our area of where the cases are. I know, we cover Windsor-Essex, but people are wondering, is there 20 cases in Windsor, 7 cases in Amherst, 4 in LaSalle? Is there any way to know what that breakdown is?
There certainly is, and sometimes we are limited by the data that we have when we are collecting those data from the residents. There is a risk and benefit of having those breakdown, and I think I would like to emphasize that these numbers, as much as people are curious to know what this number mean for their local area, but it also gives some people a false sense of security by saying that, oh, my area, I just have 1 case or 2 case or 5 case, and it's not a problem for me. But for area like Windsor, Windsor has lots of cases, so that's a problem space. That is not true. The likelihood when we are having all this community transmission is equally same everywhere, is the same from a risk perspective. If you're following all those recommendations, we should be taking all those precautions and protect ourselves. We will try to look at the breakdown of these cases by municipality now that we have enough cases, but I just want to reiterate that it is not to give any indication that which areas are bad or which areas are good. It will just give us a little bit more information, and we'll try to present that data tomorrow.
Okay, thank you.
Any questions from CBC?
Yes, good morning. Can you go over some of the long-term care home numbers? There's been quite an increase, 61, I believe, at the Country Village Homes. Can you go over those numbers? Is it just from testing that we're now knowing that there's more people with COVID?
So we, all the numbers, most up-to-date number will be posted on our website, and you can visit our website for the most accurate number. I don't want to misquote any number. I don't have the website in front of me. But what I can tell is because of some of the recommendations from the ministry and expanding the testing criteria, even for people who are not showing any symptoms in the long-term care home, but could be considered as high risk or could contract the virus, we are actively doing testing on those individuals, and there are some homes that we are targeting that are currently under COVID-19 outbreak, and we are thankful to our EMS partner to help us with the swabbing process. So every day, yesterday they went to one of the facility, they did some testing along with our public health nurses and public health inspector. They went there, they did all the testing. We sent all those labs for analysis. So hopefully we'll see another increase tomorrow because all those results will come back tomorrow. And then today as well, they are out there. They are doing some of those additional testing, and the whole idea behind doing this additional testing is it's very easy for COVID-19 to spread any of these facilities. The more proactive we can be, the better it is to try and contain it. We are taking all those recommendations and all those guidance from the ministry. We're also doing our local risk assessment to make sure that we are using the best available evidence to take actions in each of these facilities, and we'll continue to do that.
Okay, I know we have a lot of precautionary measures in place for these long-term care homes, but Sun Harbor is a brand new outbreak. Is there something maybe being missed as to why there's now a new outbreak at a new long-term care home?
So these facilities, as we know, people are vulnerable, and they need more care and more protection in any of these facilities. The ones that are currently in COVID-19 outbreak and the ones that are not in COVID-19 outbreak. there is an active surveillance strategy that is there, that we work with the long-term care home. We provide them with the tools and education. They are supposed to do all these active monitoring of any resident, ensuring that they are doing twice daily temperature check, they're doing their symptoms check. And that way they are able to detect anyone with even with mild symptoms. The moment they identify that individual, they do the swabs on them and send it for testing. When we get the test results back, even one case could lead to the declaration of an outbreak, and that is what exactly is happening. So picking up cases, I think it is good that we are picking up those cases early. But on the other hand, I think what is happening is we need to look at some of the infection prevention and control measures to make sure that those are being implemented correctly and accurately. And as much as training and education we provide, even with all the best intention, sometimes there are some gaps, and that's what we need to focus on, that how do we reduce those gaps and how do we ensure that we are providing the training, we are providing all the guidance to the long-term care homes to follow those recommendations and guides, and while they're taking care of their clients.
Okay, we're still trying to speak with the long-term care homes over I believe it's still 10 out of the 17 deaths were in long-term care homes. Have you changed your stance on providing those numbers, or are you still citing privacy concerns?
I would still say that in any of these deaths, it's really doesn't matter which facility it is. It is a death. It is a person that we are talking about, and we should be respecting all those individuals' privacy. And when it comes to taking the public health measures and working with the long-term care home, we do that. And we are putting all our resources in ensuring that they are getting everything from a public health standpoint. Our inspectors, our nurses, our team is in regular contact with all of these homes to get them to do what they need to do. But as far as the numbers, right now, still we want to make sure that we are giving the aggregate number, which I think is important for the community to know. Getting those breakdowns, I think there is that element of privacy that I still feel that we should follow.
Okay, thank you.
Any questions from Windsor-Essex?
Is testing still taking 24 to 48 hours? We've heard from some younger people who are told their results, they won't see the results for up to 7 days.
So as you can see, when Theresa mentioned all those testing criterias and and who should be prioritized for testing, most of these tests are returning back if any of those individuals are in the high risk criteria. So we are getting those results back because we need them if someone is in the hospital, if someone is a healthcare worker. I cannot speak specifically if there has been that long of a delay, but something we can maybe look at individually to make sure that we have received. There's the backlog and the paperwork, the amount of paperwork that is coming from the lab is huge, and we are trying to stay on top of it. But every day, if 300 people are being tested in around the region, the paperwork that we are getting, the positives, the negatives, and sifting through it, sometimes with the lab forget to send us, and then we follow up on them. So there are a number of issues that is going on. We are hoping that when the whole system go on to electronic, where people can go online and look at the lab results, we are hoping that that would reduce some of those errors. But we can definitely try and look on those individuals if they haven't received their test results for more than 7 days.
The system going electronic, is that something that's coming soon?
It is live in some of the areas. It really depends on the lab that are doing the testing. Not all the labs are on the same database that is using this electronic reporting system, but we're expecting that it should go live from our London lab that is doing the testing for our region.
Okay, thank you.
Any questions from the Windsor Star?
Good morning. Theresa has mentioned that the health unit also follows up with those who have tested negative, and you spoke about false negatives today. Have you encouraged anybody to get retested?
So it really depends on the symptoms. Anyone, if they tested negative and if they're asymptomatic, we're still asking them to complete their 14 days isolation. But if they are developing any new symptoms or any changes in their symptoms, we are encouraging them to get the test again. But generally speaking, if symptoms are getting better, we do not go for the retesting.
Okay, and then just to clarify about long-term care homes, you said it's even if only one resident or one staff member tests positive, you classify that as an outbreak, yes?
That is correct, yes.
Okay, thank you.
Any questions from CTV?
Ooh, this one's a tough one. I mean, people love to point fingers, right? So I understand you talking about privacy. Privacy is nice, but we're into the game now. We're probably in the second period, let's say. So at some point, fault has got to fall on somebody. So is it a blanket thing when it comes to an outbreak in a home, or like who's responsible, or is it just a collective thing where everybody just needs to get on the same page? Because you guys are going out, you guys are doing your teaching and informing them on what to do, but it's still happening. So how do you pound the message in, I guess is what I'm asking.
So good question, and I'll try my best to answer that question. So what we are seeing right now in these long-term care homes is an issue that hasn't popped up just now. There's been some systematic issues that what we're seeing right now, years and years of practices and policies that has gone into where we are right now. There are multiple roles that every healthcare system partner plays in these long-term care homes. So from a public health side of the things, obviously we are focused on ensuring that a good surveillance system is in place. And by surveillance system, I mean that they are actively looking for these symptoms to detect these outbreaks. We provide early education to all these facilities to make sure that they know what an outbreak means. What do they need to do from an outbreak control perspective? What does line listing mean? How do they connect with us to get the swabs? How do they swab those individuals? And then we also talk about the infection prevention and control measures, that what they need to put in all those infection prevention and control measures. There are other agencies too who provide this similar type of guidance too. But actually when it goes back to the home, they are the one who is implementing that. And then there are other issues in terms of the funding, the staffing, whether they have the appropriate staff, whether they have the full-time staff, part-time staff, enough staff to manage all those people. And then we're talking about temporary staffing, or the role of the healthcare system in general, how these people are being transferred from one place to another. So there are multiple agencies involved in all of these. But I think the system is now identifying some of those gaps and challenges. And hopefully when we are past all this COVID-19 pandemic, I'm sure that there will be good lessons to learn and to try to streamline the system in a much better way, that it's connected, it's coordinated, and we are doing what we should do in these type of situations before it comes.
Just a curiosity thing too. I said second period of my question, so I'm just wondering, where are we in this game? I mean, are we still in the early stage? Are we starting to flatten the curve yet? Is there still a surge coming?
So good question, and I think what I've been hearing from other jurisdictions as well, that you can't really say if you have flattened the curve or passed that period unless you actually passed it already, right? But what we are seeing is the measure that we are using is the case doubling rate. So case doubling rate is a good indication to tell us that whether the cases are multiplying that quickly or multiplying at a pace where we can consider that we are actually flattening the curve. What we have seen that when we started, we have seen a huge increase, but then we are seeing a little bit of flattening happening. But again, it is too early. And we are seeing this across the province, across Canada as well. Situation in Italy or in Spain or in other places or even in US, they have seen like a huge spike in these cases. The case doubling rate was much higher than what we are seeing locally as well as nationally. So that is a good indication, but it also highlights the important part that we have to continue these measures because the diseases still exist. We still have cases, we still have people with active disease. And if we feel that, we are in a better shape and we are reducing all these measures, or let's just go back to normal, we can see this surge happening much more rapidly, and things can get worse really quickly. All these public health measures that are put in place by various levels of government, our role locally, we are seeing some of the benefits. You've heard from the hospitals that they are doing relatively better in terms of the inpatient hospitalization, thanks to all the public health work that is happening in the background to ensure that people are being monitored. All these case and contact management is happening, and people are getting the message that they should, because that's what the critical part hits. If the hospital capacity starts to exceed, if the ICU capacity starts to exceed, that's where we start to see that everything starts to fall down. We already heard that we have more ICU cases outside of GTA on a per capita basis. That is something that we should be looking at, and we should be focusing that, if it exceeds, how do we fill that gap? So right now things are working as best as possible. There's always room for improvement, but I think we shouldn't lose that sight that we are not out of the wood yet. We still have to stay course, and we still have to do everything that we are doing right now to protect the whole system and allow the system to react in a capacity that is beneficial for the community and that protects the community.
Any questions from Blackbird?
Do you have an idea of how accurate these tests are? Like, how likely is it to come back negative? Is there a percentage point or something like that?
So there is all those lab people who are doing all of these testing. A lot of those testing are happening even right now, every time when we are getting all those labs. So the labs try different techniques. Sometimes they just do some sentinel surveillance system. Basically, they're just swabbing some people without any symptoms, just to do that comparison and do that fair testing. Right now, what we know, I don't have the numbers, but we know for sure that any type of PCR testing is very sensitive. And it is important that the proper technique is used to do the testing. And combining all those things is important for us to get the right results. I know that there are other serology-based testing is now getting approved. One of that was approved in Canada, but there are other serological testing that are approved outside of Canada. There are some limitations and pros and cons of using any of these testing. By far, everywhere, the PCR-based testing is still the most sensitive and reliable test that is happening across the world. The only issue is there is a delay in getting the results. So I think that's what we are trying to work on, that how we can coordinate the system to get those test results early. Other than that, I feel confident in the PCR testing. If it's done correctly, it is giving us the results that we are hoping for.
Any further questions from the 800? CBC?
No, thank you.
Windsor?
No, thanks.
Windsor Star?
No, thank you.
CTV?
Have a nice day.
Okay, thank you. All
Blackbird? Thank you.
right, thank you.
Thank you. Have a good day.